Hi, I'm Mrs. Haney.
Hello, Mrs. Amy.
Who am I speaking with?
My name is Kristen Zawada, and I'm a compounding pharmacist out of the Toledo area.
And where did you go to high school at? And like what program did you participate in?
So I went to Amherst High School, and I participated in 2 years in the medical technology program.
Really?
And I graduated in 2011, which seems like forever ago.
There we go. You look familiar. No, just joking. So I just wanted to touch on that. And I really appreciate you giving your time.
Of
So my
course.
question, and we talked previously, so we talked about over-the-counter topicals. And I realized that you work with prescription topicals for pain
Sure.
management. So I would love to hear your feedback on that and kind of where the trend is, because we know this whole project is about decreasing narcotic use and
Sure.
the addiction component. So give me your thoughts on what's happening now with topicals, prescription topicals. Thank you. Go ahead.
Sure. Okay. Sure. So, I mean, with the narcotics, you have tendency to have addictive properties with those. You have the thing that you don't want about narcotics is that you build a tolerance over time and you have to constantly keep increasing the dosage and promoting more risk to yourself. With a topical product, especially with compounds, you're really just tailoring it to the specific type of pain that you're experiencing. So a lot of oral medications can be put into a topical form. We actually use tablets or capsules and crush them and put them into a topical form so that you're really just getting local absorption to the tissues you're applying to, rather than exposing your body to a lot of oral medications, inducing side effects, drug interactions, and that kind of thing. A lot of pain that we tend to treat is nerve-related pain, so anything you would take by mouth, you can just use topically instead. Another topical that's becoming more common for us too is CBD, which I know with athletes can be kind of controversial because if it contains THC, it can show up on a drug test. And of course, that's not something we want, but there is some CBD that does not contain THC, and it's been helpful for a lot of our patients.
Oh, that's interesting because like you see it, but sometimes I'm not sure if I should trust it. So how does
Right.
one go about, the CBD oil that's at your, I don't know, how do you trust that? I guess is my
Sure.
point here. What is the good stuff?
Sure. I mean, I know there's some component of doing your own research to look into the brand, but I can tell you that the brand that we carry they're very transparent about their process, and they have something called a certificate of analysis where you can look up every batch that's made and they'll tell you exactly how they did it, exactly what's in it, and you know that it's a trustworthy product. Not every product has that available to their clients, so it's not something that you're readily available looking at what they're giving you, basically.
Okay, so if somebody were watching this, which I'm sure will have millions of views, if they went to their doctor and they said, I really don't want to take this medicine, what name would they ask the doctor about? What is the, I don't know, generic or the brand name of compounding, that they would say, hey, Dr. Smith, I'm really interested in maybe using this topical instead of taking this pain medication. What term or word would they be using?
So I think the use of compound is in general a good word to utilize, just meaning that it comes in a different form that it normally does at another pharmacy. We have to manipulate it in some way to make it different. There's a lot of different medications that we can put into it. Basically, we can use whatever we want, but just saying that it's a compound in general will kind of flag so that they know exactly what they're looking for.
Okay. Thank you. Thank you very much. I'm so proud of you. I'm so glad you're
Thanks.
doing
Thanks.
well. I appreciate it. And thanks for taking your time. So, all right. Well, all the best to you. And the students appreciate it. And we'll be pushing these things out probably in March. We're going to